Namaste and greetings. I, Shivani, researcher at IMPRI, Impact and Policy Research Institute, Prabhav एवं नीति अनुसंधान संस्थान, नई दिल्ली, extend my warmest welcome to you all to IMPRI Web Policy Learning. Today marks the day 7 of PPYF Public Policy Youth Fellowship Cohort 2.0, an online national autumn school program, a 4-month online immersive introductory leadership certificate training fellowship program. The chairs are Dr. Manorama Bakshi ji, Director and Head of Healthcare and Advocacy, Consortia Advisory, Founder and Director, Trilok Raj Foundation, Visiting Senior Fellow, IMPRI. Co-Chair, Dr. Purnima Chauhan ji, IAS, retired, former Secretary, Government of Himachal Pradesh and Director, Himachal Pradesh Institute of Public Administration, Visiting Senior Fellow, IMPRI. The conveners are Dr. Simi Mehta ji, CEO and Editorial Director, IMPRI. Mr. Arvind Oni ji, Urban Poverty Thematic Lead at Indo-Global Social Service Society, Visiting Senior Fellow at IMPRI. Dr. Arjun Kumar ji, Director, IMPRI. Before we begin, I would like to state the housekeeping rules. Please join the meeting on time. There will be a Q&A session after each presentation. Share your questions on the Q&A box. The questions must not be posted as an anonymous attendee. Ensure that your questions are precise. Refrain from making general comments in the questions to save time. To begin today's session, I would like to invite our chair, Dr. Manorama ji, to share her opening remarks. We welcome you, ma'am, and over to you.
So Neha, I don't want actually to waste time on opening remarks. I'm more keen to listen like our fellow students, and we have 15 to 17 presentations today. So let's go directly to that, and maybe
Sure, ma'am.
probably like in between I'll be making
All
some
right, ma'am.
remarks.
All right, ma'am, sure. Moving forward to the fellows presentation, fellows are kindly requested to accept the invitation to join as panelists. This will enable you to unmute and turn on your camera and share your PPT. All the best, everyone. Our first presenter is Shivani Chauhan, that is me. I request Sneha to kindly share the screen.
Neha, can you please share PPT?
Can you see my screen now?
Yes, we can see the screen, but
Is the PPT visible?
Shivani, you can start. Your 5 minutes will start. Okay?
Sure. Good morning. My research looks at the paradox in Indian education. Enrollment is nearly universal, but the huge share of children still can't read or do basic math at their grade level. This is often called learning poverty, and my brief focuses specifically on grade 3 to 5, incorporating the latest post-COVID evidence. Let me walk you through the motivation, the evidence, and what I'm proposing. Moving on to the slide 2, motivation. Next slide, please. So here's the core problem. India passed the Right to Education Act, and enrollment at the primary level is now close to universal. That part of the story is real success, but enrollment isn't the same as learning. According to most recent ASER 2024 data, on the right, 76.6% of class 3 students in government schools still cannot read a simple class 2 level text. This means despite years of schooling, and most children in this age group haven't picked up the basic reading skills expected of them just one grade below. This gap compounds over, which later is seen in higher dropouts. And this window matters right now because Nipun Bharat, India's national mission for foundational literacy and numeracy, has a deadline of 2026 to 27. Next slide, please. Post-COVID shock and recovery. So this slide shows that COVID-19 didn't create this learning crisis. It made the existing problem much worse. Walking through the timeline, schools closed nationwide in March 2020. By January 2021, the Asim Premji Foundation directly tested over 16,000 children and found that 92% had lost at least one basic language ability and 82% had lost the basic math ability compared to what they could just do before schools closed. So this isn't just failing to progress, but it's actively forgetting skills they already had. Then by 2022, when ASER could finally survey nationally again, we saw that lowest reading scores recorded since ASER began in 2005. So only 20%, 20.5% of class 3 children could read class 2 text. The good news is that by 2024, there's a real recovery up to 23.4%, but that's still below the 2018 pre-pandemic baseline. And recovery has been very uneven across states, which is actually central to my research question. Then at the bottom, we can see that on average, in low and middle income countries has lost 37 weeks of instruction, nearly a full academic year. And UNESCO estimates that a single lost year can take around 9 to 14 years to fully recover if nothing is done. Next slide, please. Moving on to literature review and research questions. So here's a quick snapshot of the key literature that grounds this brief. The World Bank 2019 concept of learning poverty, which says kids who can't read by age 10, gives us global pre-COVID baseline. Then Asim Premji Foundation 2021 study, which I was just described, documents the pandemic shock specifically for India. Then Land Pritchett's 2013 work, Schooling Ain't Learning, gives us theoretical explanation. He argues that in centralized school systems, children get promoted grade to grade without matching increase in what they can actually do. And then Banerjee, Duflo, and colleagues work on teaching at the right level or TAL, gives us the strongest evidence we have on what actually works. Gains of 0.15 to 0.28 standard deviation, but only when there's sustained mentoring support alongside it. Then on the right side, I have my three research questions. The first asked why enrollment hasn't translated into learning. The second asked why recovery, since the pandemic has been so uneven, both across the subjects and the states. And the third asks which specific implementation mechanisms, things like how often you assess kids, whether teachers get mentoring, whether there's accountability, actually explain the gap. Next slide, please. Moving on to the methodology. So this is a DEX-based mixed method policy analysis. I have systematically analyzed existing national data sets. First, I analyzed the secondary data through ASER, the government's NAS and Parak assessments, and Nipun's Bharat own monitoring dashboards. Secondly, I specifically compared the pre-pandemic 2018 baseline against the 2021 and 22 shock and the 2023 to 24 recovery data to isolate what the pandemic actually changed versus what was already a chronic problem. Third, I do a comparative analysis of high-performing states like Kerala and Tamil Nadu versus lagging states like Bihar and Uttar Pradesh to understand what's dividing the gap. And finally, I synthesize all of this into recommendations that are tied to specific delivery mechanisms and outcome metrics. Moving to the next slide, to the empirical findings. First, the 92% and 82% figures, that's the pandemic learning loss I mentioned earlier from the Asim Premji Foundation. Second, teacher absenteeism, nationally representative data from Madhuri Dharan and colleagues found that 23.6% of teachers are absent from public schools during unannounced visits, costing the system around an estimated $1.5 billion a year. This points to a governance and monitoring problem, not just a resourcing problem. Third, the TAL, teaching at the right level, learning gains 0.15 to 0.28 standard deviations, which in education research is actually a very large effect size, among the largest ever recorded in the randomized evaluation in this field. And fourth, the state disparity. The Kerala has 64% of class 5 students reading at grade level, while some lagging states are below 30% under the exact same national policy, which is Nipun Bharat. Slide 7, please. The implementation and measurable outcomes. So these are the recommendations implementation pathways and measurable outcomes. So instead of saying just saying that assess children regularly, I specify termly diagnostics using Nipun Bharat's own existing Lakshya Suchi framework with a target of 15% point increase in grade level reading. Then instead of just saying scale teaching at the right level, I specify embedding it as a daily timetabled period following the Haryana model that's already been proven to work, aligning with the World Bank Rapid Recovery Framework with a target of zero point 0.2 standard deviation again within 24 months. Moving to the next slide, please. To close, uh, I would say COVID-19 didn't cause India's learning crisis, but it turned a chronic, slow-moving problem into a sharp, well-documented shock. And recovery so far is real, but incomplete and very uneven. Every recommendation in this brief is now tied to a concrete delivery mechanism, which is what moves this from this to a something policy ready. My next step is to pair the state level comparison, Kerala and Tamil Nadu versus Bihar and Uttar Pradesh, which will explain the gap. Thank you.
Thank you, Shivani. Shivani, I would like to know the reason of choosing these states like Kerala and Tamil Nadu versus Bihar and UP. Is it because of the educational, percentage like of the students? What made you choose these two states?
At the primary grades, these states are the most best performing states, Kerala and Tamil Nadu. For the grades, I've chosen 3 to 5. For those grades, these states are the best performing states, and Bihar, while on the other hand, Bihar and Uttar Pradesh were the least performing states. That is why I've chosen these two contrasting states.
Number second is Shivani, you spoke about, how, I would like to know how large the gaps have been. Like you spoke about enrollment is high, but learning poverty persists, like in your paper. So I need to know like specific learning outcome data. Like for example, is it state, rural, urban wise? Have you gone at like at different tiers or different rural and urban wise? What are the relevant disparities from block, district, and those kind of levels? Have you gone that deeper? That
No,
is
Mama, I've not gone
establishing the
that
learning
deep.
gap.
I've just seen the state as collectively. I've not characterized into block and the district level. I've just taken it, the state as a whole.
Okay, and the brief proposes that the major, teaching at right level, like what
Yes.
your policy brief talks about. So how will the teachers identify each child's actual like learning level at each, class level? How are those? I think that in your paper you need to identify that as well. Like how are we going to identify each child's, actual learning level? Is it at the entry level or is it at the class level or should we retain them? A brief on that, if you can explain like what is the assessment, what will be the grouping or targeted, teaching methodology or reassessment kind of thing. Are you taking that into also like, consideration like?
Mom, in my paper, I'll surely take all these into consideration. Right now, I have not gone that deeper, but in my paper, when I'll be writing it, I'll surely include all of that.
Okay, overall, this is a very good policy relevant concept, and you have actually done a lot of work. You have included a lot of data sets and all that. I would just a bit of like strengthening the evidence, specify the implementation architecture, like when you're talking about Tamil Nadu and Kerala, and then you're talking about the UP and Bihar. I would like you to, in the paper, specify the implementation architecture and demonstrate like how you are going to have the measurable indicators. What are the key indicators that you will like assessment, maybe towards the targeted pedagogy or maybe towards capacity of the teachers or something of that sort that will translate actually learning into the gains. If you can look at when you are choosing these states. Plus, I would also like to know a bit like post-COVID, like you have, I would like to know exact like how much has been the difference? Like you have said, there has been much difference like post-COVID when the students came back. So can you actually measure like what was the difference like before and after like within these years? If you can a bit talk about that, like. and gaps between, the pre-COVID baseline through and then post-24 level. If you can show that. Overall, very good presentation, Shivani. Thank
Sure,
you.
ma'am. I'll include all of that. Thank you, ma'am. Thank you for your valuable feedback. I'll incorporate all that into my paper. Thank you, ma'am. Next, we have Siddharth Singh.
I hope I'm audible and visible as well.
Yes, you are.
Yes.
I'll just share my slide. Just give me 1 minute. I hope it's visible now. Yeah. Should I begin?
Yes, sir, you can begin.
Yeah, thank you. The topic that I chose for presentation was the effects of climate change on rural health. So I could not do my work entirely till now. So I have presented one of the pillars that I'll be utilizing for putting up in the entire paper. So for this particular presentation, I have chosen the title Climate Health Topography of Rural Communities. Uh, Climate change is emerging as a major determinant of rural health in India, as we all know. Climate-related hazards and changing disease etiology interact with existing weakness in rural health systems and particularly affecting the social determinants of health. So the rural populations are particularly vulnerable. Why? Because they are dependent on agriculture and natural resources. They have an exposure to outdoor heat, limited housing and cooling infrastructure. They're dependent on biomass fuels, as well as they have a very strong geographical barriers to healthcare and socioeconomic constraints on their own part. So the problem statement is for my presentation, it's climate change is increasing health risks in rural India, while rural health systems and communities have comparatively limited capacity to anticipate, prevent, and respond to those risks. So while looking at that problem statement, I have designed an entire concept for categorizing that entire problem. Climate hazard, it causes differential exposure among urban and rural. So I'm focusing on rural, and even within rural, there are different levels to which that exposure can be differentiated depending on how much developed the rural area is. Then based on that differential exposure in the rural area, you have socioeconomic vulnerabilities, which in turn causes health effects, and health effects on a systemic level causes healthcare disruption when it goes beyond a certain level. And then because of the disruption in healthcare systems, we have a reduced adaptive capacity for further damage. Then this overall increases the vulnerability of the system, and it creates an entire cycle which repeats itself. Based on the cycle, we can see that the entire concept can be divided into two parts. One is the population part, where we have the exposure to the health effects, and the systemic parts, where the disruption increases the vulnerability overall. Then the entire cycle, it creates a reinforcing mechanism in which the climate change worsens health and livelihood security, while illness and economic losses further reduces household capacity to adapt. So what is the magnitude of the problem? So I took on the Lancet Countdown series, where the most recent Lancet has a countdown paper has estimated that it demonstrates the increasing magnitude of climate-related exposure in India. In 2024, people in India experienced almost 19.8 days of heat waves, out of which 6.6 days were directly attributable to climate change. Heat exposures was also associated with substantial economic consequences. India lost approximately 247 billion potential labor hours because of heat exposure in 2024 alone, with agriculture accounting for almost 66% of those losses. These findings are particularly relevant to the rural health because agriculture workers are highly exposed to outdoor heat, and agriculture productivity is closely linked to household food and livelihood security. Air pollution is another big aspect because it represents it's an important intersection between indoor pollution as well as the outdoor pollution because of the climate change related activities. The Lancet Countdown reports that household air pollution mortality in 2022 was higher in rural India than in urban India itself, at approximately 125 deaths per lakh population as compared to 99 deaths in the urban areas per lakh population. So I've done a vulnerability assessment on three parts. One is thermal stress. It causes decline in labor capacity. This thermal stress triggers a cascade of physiological impacts, which can range from mild heat exhaustion and dehydration all the way to a severe life-threatening heat stroke, acute kidney injury, and cardiovascular failures, which in itself are debilitating diseases and can lead to death as well. In 2024, heat exposure led to a record high loss of 247 billion potential labor hours in India, averaging 419 hours per person. That is almost a 124% increase compared to the 1990-1999 baseline. This loss was heavily concentrated in the agricultural sector, which accounted for 66% of the total labor cost. So air pollution compounded by household air pollution in rural India because of the use of a biomass fuel, it causes significant contribution to the existing respiratory and cardiovascular disease burden in the rural areas. In 2022, household air pollution was associated with 113 deaths per lakh population nationally. Crucially, the mortality rate from household air pollution was significantly higher in rural areas, as we have seen 125 as compared to 99. The third being an altered monsoon pattern, favorable conditions for vectors and waterborne disease outcomes. Comparing 2015 to 24 period as compared to the 1951 to 60 baseline, the average basic reproduction number, as we call it R naught, or the time it takes for the disease to infect next set of people. For dengue transmission by the Aedes mosquito in India has nearly doubled from 0.86 to 1.6. Similarly, what it roughly means in biostatistical terms is that now the disease is affecting twice the number of people as it was doing in 1951 to 1960. Similarly, waterborne pathogens are responding to warming waters as well. In 2024, the coastal area is environmentally suitable for the transmission of Vibrio bacteria. The pathogen responsible for cholera and severe diarrheal infections was 46% higher than the 1982-2010 baseline. I could not complete the entire what do you say, the presentation, because it's still in the middle of the course. The further aspects that I would like to include in my future presentation would be structural vulnerability. As we have seen, we have till now seen the epidemiological vulnerability. I like to include structural vulnerability in that, social demographic vulnerability, institutional vulnerability, and the operational gaps. I would suggest my own how to bridge those gaps and what is currently happening, as well as policy recommendations. These are my references. Thank you.
Thank you. That's a very relevant, pertinent climate health system policy concept you have mentioned. But I feel that you have a very broad narrative wherein you have from climate related health risks to clearly define the framework from climate. So majorly, I would like you to stress on a couple of things, like as a policy person. Like, for example, you're talking about the policy problem. I would like few of the things, like the topic is currently very broad. You're talking about diseases, infrastructure, nutrition, gender, and other things. Like climate is increasingly health risks and rural vulnerabilities. One is like to make it, you can make it like, that is just my suggestion, to make it climate resilient for rural health systems in the central policy. Because suppose I am asking you simply one question, like if I will tell you that, okay, how can you make India's rural healthcare infrastructure and service more resilient? Like, for example, I will give you primarily like public health policy or climate adaptation policy. So these are few of the policy questions like you have to ask yourself. Like, one is you have mentioned about the climate sensitive diseases like heat stress, vector-borne disease, malaria, dengue, वो सब आपने लाया उसमें. फिर आप कह रहे हो health infrastructure vulnerability. तो क्या आप like for example primary healthcare service है, how are you going to maintain those kind of things, like extreme weather disrupts it, what are you proposing in the policy about that? Vulnerable populations, like when you spoke about the defining climate proofing, so how are we going to, is it like resilient infrastructure, continuity of essential services, or preparedness of the trained healthcare workers for that matter? Second, I would like you also to, like you mentioned somewhere about 40% of the districts face very high some climate risk or something you have mentioned. My question is, which source? Like you have said so many villages, X and Y, Z's. I think you need to mention either the source, like Lancet you said, but Lancet ne किन मतलब resources या geographies को this is based on, I would like you to clarify like what are the sources and explain the indicator geography in relevance to the health facilities that way like. And when we talk about the policy convergence, here you need to talk a bit about the convergence of the programs. Like, for example, how the inter-ministries, inter-departments or roles of the health, along with the climate, along with the environment, along with the disaster preparedness, along with the panchayats, along with the rural development. How are you going to identify these kind of coordination and what are the actual challenges in coordination? Are there some coordination breaks?
Ma'am.
So if you can make it like that kind of a, because it's a very good policy document and policy idea, but how we are going to make it like,
Comprehensive, ma'am.
yeah, comprehensive.
Ma'am,
And
I'll
recommendations, how we can make it operational, like for anybody to take it forward, like policy.
indeed, ma'am.
Thank you, Siddhartha.
Thank you,
Overall, a
ma'am.
very pertinent idea. Thank you.
Thank you.
Thank you, ma'am. Thank you for a valuable feedback. Next, we have Sneha Sharma.
Just a second, I'm presenting my screen. Is it visible?
It's getting started. Yes, now we can see the screen.
So good evening, everyone. I'm Sneha Sharma, and this is my topic, Thinking Machines and Thinning Brains, which is basically revolving around AI and education system. So the motivation behind this topic is basically there is a compulsory education, compulsory AI and computational thinking, which is introduced from class 3 onwards. That means that an 8-year-old in a classroom near you is having his first of formal government mandated encounter of first artificial intelligence. On the paper, it looks very forward thinking that a very few countries have been opting for AI literacy and they are working at this scale. But internationally, we are just relying on the critical, we just do not know how much this is related to the critical thinking in the young people and how it will be affecting the critical thinking abilities and cognitive abilities of the young children. So the real question isn't that whether AI belongs to the school, it is about the particular rollout which is happening. Is the population we are targeting ready for it or not? So here's the evidence gap that got me interested into it. So the strongest study we have linking AI use to what is called the cognitive offloading. So basically outsourcing your thinking to a tool until you get the result or you get to understand the skill you're wanting to understand. And it was one of the surveys was conducted in the United Kingdom, which had the age group of 17 to 25 as the youngest people who showed uh, significant lag in their cognitive abilities. So nobody has tested this on Indian children, and for Indian children of 8 to 13 years of age, which is the curriculum which India's policy is targeting, class 3 to 8 onwards, class 3 to 8. So that's not the reason to say that AI does not belongs to school. It is just a governance point. We are legislating a curriculum for 8-year-olds based on the evidence gathered from adults which stay thousands of miles away. What I set to do is my research question is India's class 3 to 8 AI curriculum is sequenced correctly given what we know about the cognitive offloading. What we still don't know is about how it affects the young children. I've done the deck-based research on NEP 2020, NCFSC 2023, CBSE circulars regarding AI curriculum, alongside UNESCO's generative AI guidance, including the recommendation that minimum 13 years of age should be for the independent AI use. So, layering all of that, a 23 item survey has been formed by me, and which is a survey which was given by a United Kingdom's institution also. So, that is one of the survey I'm trying to do alongside. So, this survey is currently going out. I'm trying to gather as much data I can regarding the critical thinking abilities which are affected by the usage of AI in the higher secondary schools and the colleges. So this survey is yet to be distributed within the IMPRI fellowship people also. So I will be sharing this survey. I would be I will encourage everybody of you to spare 3 minutes of your time to just fill this survey. Now, what the actual governance landscape looks like. So our curriculum teaches AI concepts, basic ethics, and there's no built-in requirement to teach critical evaluation of AI outputs alongside. Because education sits on the concurrent list of India, any teacher training threshold or safeguard is nothing done yet. We already have a precedent of what happens to the curriculum outruns readiness. In South Korea, we can see that the AI textbook which was made compulsory, which collapsed within 18 months. So they faced a lot of loss, and 87% of teachers have reported that they are inadequately prepared for the given AI curriculum. So here's what I'm proposing. First, that the class 3 to 8 rollout of minimum trained teachers threshold as per the district using UDICE and Samagra Shiksha data. Commission on India specific evidence based pairing with ACER modules. I would also like for independence of CBSE curricular that class 3 to 5 should mean that teacher mediated exposure and not an independent use of AI consistent with the UNESCO's guidance. Reform assessment in parallel with curriculum oral defense in class unassisted task. So the incentive of offload thinking to AI is addressed at its core. To close, it is not an argument against AI in schools. It is an argument for sequencing and getting the readiness for the evidence in place so that we do not repeat what happened in Korea. And class 3 is a very small group of children. So, and they are actually developing their cognitive abilities at that scale, at that age. So I would like to have more governance in this segment, that if are we infrastructurally ready for what we are doing. And my main idea is about getting enough data from the survey I've created so that I get to know that are we really prepared for rolling out this curriculum or not. Thank you.
Thank you, Sneha. Hello, Neha, am I
Hi.
audible right now?
Yes, you're audible.
Okay, so actually, this again is very, very, timely assessment, I would say, a timely and provocative educational policy. But for me, the paper needs to move carefully from concern of, AI-induced cognitive decline when we talk about to major evidence, distinguish between the correlations from causation and propose AI in education. Like, for example, at even though like she has used strongest base when she's talking about the AI in educational evidence, and then AI UNESCO's report and policy she discussed about. But my comment on this is that, for example, you have said about the cognitive decline. So when we say cognitive decline, you have to identify or at least measure like what are those 2 or 3 measurable cognitive declines that you are talking about, like learning outcome, those kind of. What exactly you mean by cognitive decline? Is it the critical thinking decline, or is it the way people used to comprehend and memorize, or writing, or problems solving, or that kind of. The concept you are trying to say is excessive dependence on AI weakens this cognitive decline. But here you have to establish it like what does cognitive decline actually mean? Second is
Okay.
when you are talking about establishing the evidence. That's good that you are also conducting a survey wherein you will come out with some kind of assessments, and you will come out with what possibly will come out of that research, and when it comes to the cognition to employability. Right now, we have said that reduced, thinking could affect the future employability. But as of now, since AI has recently come up, so we are not very sure which skills actually employers are looking for. Like, for example, if the employer is only looking for those kind of skills, like maybe AI skills. So
Yeah.
which kind of skills will actually be impacting? Like which skills are employers looking actually for, and which might AI, strengthen? Like when we talk about the critical thinking or problem solving or communication, uh, at the same time, we need to know domain knowledge as employability outcomes kya honge uske, those kind of things, and what does it make? And the paper should not show as AI is something bad.
Hmm.
The title creates a strong warning about the AI.
Hmm.
We can have balance like AI in educational framework, or maybe probably you can have some kind of, reframe it
Hmm.
rather than cautioning. So
Okay,
that
got
is
it.
one thing, but I think that in nutshell, I can say that before concluding that AI is causing the major or cognitive decline, let's demonstrate what cognitive ability is. And then future, like for example, because this is going to change overall if you are looking at from, for example, AI can help with research or brainstorming, or maybe use AI for assistance, but
Hmm.
preserve the human cognitive. I mean, the better policy approach should be preserve your cognitive, human cognitive effort, but use AI for assistance, like maybe for those kind of things. So if you
Oh.
can a bit like, or how AI literacy, how the teachers, how AI literacy assessment reforms and cognitive skills can come together, like AI literacy, like what is these students, how AI can be used, responsibility. Then assessment reforms, like how we are going to do the assessment of the students, like about their reasoning and those kind of things. And how we can through AI also strengthen their this thing. So central policy question for your this should be that how can India's education system integrate AI responsibly while
Hmm.
ensuring that students continue to develop the cognitive and human capabilities? That should be the policy question, and based on
Yeah,
that,
so
you
that's
can
why I
have
had
recommendations. Yeah.
yeah, that's why I had that grade 3 to 8. They have introduced AI, but I'm looking at that the infrastructure is still not prepared for it. Like the teachers are not prepared. So that is one question I want to include into it.
Yeah. Yeah.
Yeah. Thank you so
Actually,
much.
paper needs to tell the government, like education students, what to do. Recommend maybe probably AI literacy or assessment reform or
Hmm.
teacher capability or those kind of things. Like, and maybe probably your this survey will give us a lot of feedback, or you get something out of that.
Yeah, got it.
Thank you.
Thank you.
Thank you, ma'am. Thank you, Sneha. Next, we have Rindikon ji.
Uh, am I audible?
Yes, you are.
Is my presentation slide visible?
Yes, it is visible. You can go to full screen mode.
Okay. Uh, Good evening, respected Dr. Manorama, the host, and my fellow participants. I am Rinechon H. Shimre, and the policy that I am preparing to present today is titled Political Representation and Women in India, an Analysis. Since the time of India's struggle for independence, women across the nation contributed and played their part, even going above and beyond. And befittingly so, in the Constituent Assembly, even though it was limited in numbers, 15 women were members of the drafting committee, which emphasized the need for democratic equality in all perspectives. Likewise, even in the first cabinet, despite being male dominated, the health ministry portfolio was given to Amrit Kaur. However, despite the contribution made by the political participation of women, it was not until 1996 through the 81st Constitution Amendment Bill that effort for reserving 33% of seats for women was made after the dismal parliamentary representation of women that stood at just 6.5% in the 543 seats of the Lok Sabha. But it was not after the lapsing of the bill for 4 times that the demand for reservation finally saw the light of the day through the inclusion via the 106th Constitutional Amendment Bill in 2023. At present, in our 18th Lok Sabha, only 74 women have been elected in the 543 seats, despite showing that they were able to perform better and win in comparison to the male candidates. Even from the global perspectives, only 27.5% of all MPs are women, with progress of political representation of women stagnating at 0.3% for the past 2 years. Likewise, women leaders occupy only 23% of cabinet portfolios. At this rate, it is being pointed out that gender parity at the cabinet level would not be reached before 2077. Despite enough evidences that shows us that women in power and women representatives have been able to enhance the efficient administration and improve government's transparency with more accountability, uh, there are challenges that impede the political participation of women. So my objective was to examine the challenges and factors impeding the higher presentation of women at the state legislature and the parliament, and to analyze the gap between the high participation of women in local bodies after reservation and the failure of translation into higher representation at the state legislature and parliament as corrected, to evaluate the capacity building programs, legal safeguards, and policy implemented or undertaken for effective enforcement mechanism for greater political representation of women at the state legislature and the parliament as recommended. The analysis was undertaken using mixed methodology with collecting data from various government reports, think tanks, and institutions, and secondary sources being sourced from articles and organization reports. The challenges and issues that represent is that, apart from equitable representation struggles, women political leaders and parliamentarians experience more public intimidation, both online and offline. Similarly, gender stereotyping and patriarchal norms have seeped into the politics, often undermining the values and contributions of women leaders, lack of party support and financial resources, lack of political and formal education, and limited access to information with absence of political autonomy and lack of political will have been identified as key challenges. There are also the issues of unintended impact of reservation policies such as the practice of Sarpanch Pati, where men relatives, mostly husbands of the elected women, are running the offices in their places. So the policy recommendations that I have gone so far is, apart from constitutional reservations at the political party level and quotas should be integrated, which have shown to be highly effective at raising female representation. Apart from gender quotas, provisions of targeted support and training to run for office, including equal access to funding, which have shown success, can be implemented by creating institutional framework. Use of media to spread political awareness and political education, such as the campaign undertaken by the Ministry of Panchayati Raj to eliminate proxy representation and promote genuine women leadership by collaborating with media productions, by producing compelling digital content, could be adopted for promoting women representation at the legislature and the parliament level to remove gender stereotypes, and pushing for better formal education and inclusive alignment of the various policies undertaken to promote women empowerment with effective departmental and ministerial coordination practices could be effectively pursued. Effective and continuous sensitization of policies and awareness programs regarding political participation and leadership of women across institutions right from the school level could be undertaken, which will further be re inclusive with the recommendations from the experts. Thank you.
Thank you so much, Shimri.
Yes, ma'am.
Shimri, yeah. So thanks, Satan. And your policy is actually addressing primarily like gender policy, democratic governance, and political representation with elements of a bit of electoral reforms, a bit of political party reforms, constitutional reforms, and institutional review. My comment to you is you need to sharpen your policy problem a bit. Like
Okay.
your abstract says that women are underrepresented in parliamentary and state legislators, but the current framing is too broad. Like what specifically prevents women from entering it? Like patriarchy, you said one of it. But if you can say a few of more, like for example, party nominations or maybe financing that does not allow them to sort of enter into, or maybe political networks and those kind of things, if you can sort of add into it.
Yes, ma'am.
Besides this, if you can add like latest, like which I was just now going through it, latest, if you can talk about Nari Shakti Vandana, which had come up, wherein we had mentioned that the government had proposed bringing 33% reservation for women in
Yes.
Lok Sabha and state assemblies,
Yes.
potentially making it applicable from 2029.
Yes, ma'am.
So that is Government of India. And if you can just look at the other geographical, maybe the countries of how many countries have done this kind of a thing, like wherein they have given it like, okay, there will be 33% reservation for the people at the women at a higher level also.
Okay, ma'am.
Second is to add to local and national dimensions. You spoke, no doubt, your policy is talking about the state and central level, parliament level reservations only. But I'm talking here about if you can learn, we can talk a bit about the women larger scale participation in panchayats, like and
Okay,
urban
ma'am.
local bodies, wherein like
Okay.
local I mean, you have not emphasized that in your paper.
Mm.
And if you can also, like, for example, the political agencies and proxy representations, which you have addressed, like Panchayat Satis and all that.
Yes,
But
ma'am.
how we are going to sort of have the numerical representation of this whole sort? Can you find out, like, how
Okay.
many of them are, how you can distinguish the representation from the political agency, like? And most importantly, I see that this is a very, very important, policy brief. But first, if you can identify the problem system, what are the barriers?
Okay.
Demonstrate it with evidence. What evidence talks? If you have some kind of numbers that support it or some kind of researches that support it,
Yes,
then
ma'am.
propose specific interventions. Like,
Okay, ma'am.
and who will do what? How many like problem evidence and then implementing? Is it the election commission? Is it the legislature? Is it the political parties? What we call the stakeholder mapping, like? And what is the outcome, like? What are the indicators that will give you a high proportion of women candidates and those kind of things? If you
Yes.
can look it from those angle and have the stakeholder mapping, like, maybe probably that will strengthen it.
Yes, ma'am.
Highly relevant to gender democratic governance policy document.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you, ma'am. Thank you, Shimreji. Next, we have Pranjal Pandey.
Hello, am I audible and visible?
Yes, you are.
Is my screen visible?
Yes, yes, it is.
Okay. So a few months ago, most of the Indian population witnessed heat waves, which were very catastrophic. And heat waves are periods of abnormally high temperatures witnessed in a specific region. To recover from those or to mitigate those, heat action plans are required. So with that, a very good evening. I am Pranjal Pandey and my topic is evaluating heat action plans in India. So the motivation for this topic, with over 75% of India's workforce exposed to dangerous heat, escalating summer temperatures, are devastating lives and livelihoods. Selecting this topic was important, stems from the urgent need to bridge climate science and local governance, to safeguard marginalized population and to protect labor productivity, and to build institutional resilience against future climate risks. So what are heat action plans? These are guidance documents that are prepared by the state, central or urban local bodies to prepare or respond to recover from heat waves. One of the most important functions is to direct scarce healthcare, financial, information and infrastructure resources to those who are the most vulnerable. And how they do it? This requires a lot of logistical planning, political will, and regular assessment. And the regular assessment is done by vulnerability risk assessment, which requires a lot of planning as well. And technology like GIS and all can be used as well to determine which regions requires the most help and whether HAP interventions are reaching them or not. So timeline, the first heat action plan, the pilot project was developed in Ahmedabad and were devised by the Ahmedabad Municipal Corporation. It was South Asia's first heat action plan. It was devised in 2013. 2016, we had the first national NDMA guidelines. So this could confirm that heat waves in 2016 was considered to be a disaster. And how they did so? By having standardized color-coded IMD systems. So we focus here, there's four color-coded systems. There's green, yellow, orange, and red. Green stands for normal temperatures, yellow above normal temperatures. Orange and red stands for very high temperatures, and red stands for heat waves or extreme temperatures. So I can give you an analogy. Suppose in coastal areas where heat is usually high, if the temperature surpasses 40 degrees Celsius, it could be considered as a heat wave. In hilly regions such as Dharamshala or Dehradun, if the temperature goes above 30 degrees Celsius, it could be considered as a heat wave. The interesting fact here is it is under the hands of the municipal local body or the local body to say it is a heat wave or not. And next in 2019, we had the Pan India expansion where NDMA upgraded the national guidelines to cover 23 heat prone states with over 100 plus cities, incorporating interagency roles and cool roof concepts and vulnerable protection frameworks. This, after 2023, the focus shifted. Now, instead of only government intervention, we have brought in NGOs, we have brought in private bodies as well, such as CEW, Center of Energy, Environment and Water, TERI, CPR, and even World Bank as well. And here, if you look at the point of wet bulb heat indices, I'll be explaining it properly in the next slide. And it was a very important problem that was there of dry bulb and heat bulb indices. I'll be explaining in the next slide. So first, evaluation and early success. The first plan that was in Ahmedabad was a success because it proved that around 1,100 people unfortunately died due to heat waves. And it proved that by public hydration points, by healthcare readiness and interagency coordination, these fatalities could be minimized. But next, in the hazard gaps, if you could see, the heat action plans were devised based on dry bulb temperatures, which do not account humidity. These do not account humidity, and India is a very humid country. So if you don't account humidity, is the policy worth? And secondly, high minimum nighttime temperatures, especially in city like Delhi, the usually at nighttime the temperature decreases as a relief. But in cities like that in northern India, there was high nighttime temperature, there was no relief, which led to more physiological hazards in coastal and densely populated urban areas. This could lead to underreporting of heat stress, and this was a very important, very uh, policy gap. And governance and equity bottlenecks. There was under disaster management, there was zero dedicated budget lines. There was lack of enforceability of municipal plans, and people who are the most affected by the like informal laborers or street vendors, they were not considered, they were neglected uh, from their heat action plan. And the next transformative policy, the last point, discusses that instead of short-term emergency advisories, like if we Google right now how to protect from a heat wave, it would say to drink more water, to wear light clothing. These are short-term advisories. Having long-term advisories, meaning having a cool roof program, having urban green corridors, having more urban greenery, having vertical forests through hydroponics. Of course, it's a very heavy project, but we can start small in establishing enforceable social protection protocols, including mandatory shaded rest breaks and parametric insurance for vulnerable workforces, could help in the long run. And while my research, I had witnessed a lot of policy questions which I could raise over here. So the current temperature thresholds do they adequately capture humidity-driven heat stress and nocturnal heat retention? Second was the equity and inclusion. How effective do municipal action plan target and protect high-risk informal laborers? And fiscal and legal backing and policy impact, how institutional bottlenecks can be prevented and dedicated funding can be provided. And policy impact, how evidence-based structural measures like cool roof, green places give the highest reduction in heat morbidity, which could be explained in the next slide. Next slide. So methodology over here was secondary, it was completely secondary database research, systematic review. Most of the papers that were taken, reports were taken from TERI, CPR, and CEW, some from World Bank and some from scientific research papers. And comparative policy analysis was taken into consideration as well. Key findings, incomplete heat metrics. Most plants only measure daytime dry bulb temperature. I mentioned in the previous slide as well, daytime dry bulb temperatures do not consider humidity. Wet bulb temperatures do, and warm nights that prevent human body from cooling down. Severe equity blind spots, current advisories are generic and citywide. They fail to target high risk groups like outdoor daily wage workers, gig workers, street vendors, or informal blue collar, red collar workers. Lack of dedicated funding, heat action plans lack statutory backing, and reactive and long-term solutions. Most municipal focus on the temporary relief, drinking water kiosk and just sprinklers and all. But long-term cooling solution like cool roof, which requires intensive effort and funding, are usually not considered by them. So my recommendations for this topic would be to localize heat health metrics, transition from a simple dry bulb temperature cutoff to composite high indices, integrating relative humidity, wet bulb temperature, which takes humidity into consideration so that the values that we get would be proper. And high and minimum nighttime temperature should also be considered. Targeted labor safeguards, mandate enforceable midday work pauses, on-site shaded hydration shelters, parametric micro insurance to financially protect vulnerable daily wage workers. Passive structural cooling, scale high albedo. I like to explain over here. High albedo means high reflection. So in environmental science, there's a concept that if the light is reflected more, the temperature, the land surface temperature is reduced. But if the light is absorbed, heat is absorbed, light is absorbed, radiation is absorbed, the land surface temperature is increased. So the main topic over here is high albedo school roof clothing, which would be more reflective in nature, which across low income informal settlements to lower indoor heat. Statutory backing, ring-fenced budget. Ring-fenced budget, municipal ring-fenced budget is a concept where a specific amount of money is put into dedicated bank accounts so that they won't be tampered with. Usually in budget cuts, these funds are taken away, but in case of ring-fenced budget, these budgets won't be taken away. So there would be proper implementation throughout prolonged period of time. In conclusion, India must shift from short-term summer emergencies to permanent, well-funded urban planning. Building true heat resilience requires accurate local warnings that include humidity, cooler neighborhoods with reflective roofs and green cover, and strong legal protection with income support for at-risk outdoor workers. Simple alerts save lives, but long-term structural changes protect our cities and ourselves. That's it from me. Thank you.
Thank you so much, Pranjal. I think that your paper is really very good, but it has too many, too many things happening at once. Like you're talking about heat waves, then you're talking about urbanization, agriculture, energy, then heat action plans, disaster management, green infrastructure, community adaptation. So this makes it difficult to produce as a sharp policy topic. Right? For example, choose a policy intervention that you want to evaluate rather than trying to evaluate everything related to heat waves, because these are all things that are impacting the heat waves. So, what is it that you want actually like? Maybe heat wave risk, maybe state-wise like or geographically wise, heat wave action plans. Then maybe probably how are these designed? That is very important. Then the issues concerning the implementation. How are they implemented and what works and what doesn't work? Then finally, as a policy document, we say what outcomes do they produce? And based on that, you can say how should heat action plan be improved? Like, for example, if you want, I would suggest like a kind of framework wherein you'll first look at the assessment angle. Like, okay, what is the risk assessment of high risk locations, which you mentioned, like, or high risk populations? But then, what are the early warning signals? How early they have to be given, and how effective they have been? What does your data talk about? What does your evidence talk about that? Maybe probably 15 days before or 5 days before or 10 days before. And what should be the public communication? uh I mean, yeah, public communication and when we talk about local language warning, are the warnings understandable? What does the our evidence talk about reaching the vulnerable groups? So what should be the communication for XYZ state? Then, for example, are hospitals and health workers, like agencies, prepared when we talk about the health preparedness and those kind of? And about like you have to distinguish between the targeted populations, targeted protections, and those kind. And ultimately, like if you will ask me, like what the assessment should be, it should be your policy should be highly relevant environmental and public policy, but it needs to have broader boundaries. Like, for example, the broader discussion of heat waves to a systematic evaluation. Heat action plans demonstrate which policy measure or work for whom, what, under what conditions, and those kind of things you have to address. Probably I would like it to have some kind of, I see like where exactly funding comes, coordination क्या होना चाहिए, staffing क्या होनी चाहिए, implementation gap कहाँ पे है. Because ultimately we see that policy formulations are not the issues, but for policy implementations are issues. Wherein you said, you gave some wonderful example of Gujarat, wherein you said that it worked out, but some things they have not, identified the humidity and those kind of things. And you said that it did not work here. So your abstract actually mentions about the coordination and
Initiative of the
implementation
Government of India
challenges.
to bolster the local self-governance in J&K.
Huh? Hello? I did not get it.
It was from someone else, I think, ma'am. You can continue.
Yeah. What I mean to say is that identify implementation challenges like funding का थोड़ा बहुत तुम्हें दिखाना पड़ेगा, stakeholder matrix दिखाना पड़ेगा, coordination of different departments, staffing क्या है भी कि नहीं है, or is it just the policy? So those kind of things, the policy has to talk about. Overall, good concept, very good concept.
Ma'am, one point last. I'll take all this into consideration. In the article I have written, uh, due to the time constraint, I did not put everything in this slide. But in the article, if you
I have gone through your paper. Your paper has addressed different approaches. In fact, your paper is right now open in front of me, and I'm going. We have discussed about HAP, disaster management system, urban planning, climate resilience, early warning systems, public health preparedness, green infrastructure, community-based adaptations. This is what your paper is talking about. Am I right? Hello.
yes.
Overall, it's a very good concept. A bit of like you can make it like more, stakeholder matrix set kar lo thoda bahut, and then see like recommendations like what worked, what does not work, and what are the warning signals, like kitna pehla aap dena chahte ho, and those kind of things. Overall, good.
Thank you,
Yeah,
ma'am. Thank you, Pranjal.
Thanks, Pranjal.
Next we have Faizan. Your screen is visible, but please move on to the PPT
Am I
slide.
audible? Am I audible and visible?
Yes, you are.
Okay. Is screen visible?
Yes, it is.
Okay. So, good evening, everyone. My name is Faizan, and today I will speak upon the evolution and stagnation of local governance in J&K through DDC. So, the first question that would come up in our mind, what are DDCs? So, it's a distinctive model which are initiated by the Government of India back in 2020 and to bolster the local self-governance in J&K. And apart from that, there are since its inception, there has been some problems which it has been facing. What are the problem statement? The first is completion of the 5-year term. DDC, the term of DDC has been completed on 24 February 2026. Since then, there has been no election. Thus, it carried out the inefficacy in this model. Apart from that, DDCs are based on the executive order, not on a constitutional mechanism. Unlike in other states, the the local self bodies are based on the constitutional mechanism like 73rd and 74th Constitutional Amendment Act. Due to this reason, it is more flexible in nature and it does not have that kind of constitutional legitimacy. Moreover, the seat allocation is also varied. Like in Srinagar, the population is 12 lakh, and in Kishtawar, the population is 2.5 lakh, which clearly shows the distinction between these two districts, and the seats are uniform. So it shows the inequitable representation in these districts. I have also mentioned it, I enumerated the legal case as well in the Rahul Ramesh Wagh versus State of Maharashtra. The court asserted that there should be no delay in the local bodies in the local body elections. Next, although if government had Although if government have initiated something, there could be relevance as well. So what are the relevance of it? If there are demerits, there are merits as well. Earlier, what was going on in earlier panchayat elections were conducted under 1989 Act, and minimal contestation has been taken place. Like in Baramulla, there were 2,348 seats, and out of 208 seats were filled only. And in Kupwara, there were 1,695 seats, and only 152 seats were filled. And likewise in the Srinagar, there were 759 seats, and only 53 seats were filled. We showed some kind of repercussions at that time, and this information I have taken from the Chaudhary 2001. By contrast, the DDC election shows the remarkable polling numbers. 51%, 51 percentage was recorded at that time across 8 phases. The elections were conducted in the 8 phases, and despite of this, COVID-19 was going on at that time, and extreme winters were also there. Still, people showed a huge number of participation at that time, and special voting booths, transport, and voting facilities were also arranged for Kashmiri migrants so that their rights could be also ensured, and they also participated in this election. And this information I scoop out from the state election commission के compendium से. Moreover, as you know that the area has been the area in this area, this is surrounded by with a lot of controversies, but the process was devoid of violence, and center also backed it with financial capacity as well of 200 crore rupees. So what are the key findings? The first, as we discussed earlier, it was a remarkable step by the government of India. Despite COVID-19 and harsh winters, the voter turnout was 51%, and the center also backed it with funds. But as Prime Minister Narendra Modi also said that it's a new chapter written in the history of J&K. But I find out that there are several problems as well, like uneven population, as I said, that lack of constitutional backing, and there has been no elections. So these are the issues. And what are the indicative policy actions? The first, there should be a constitutional guarantee, like 73rd Amendment Act, and we can also adapt a district planning committee under Article 243 ZD, and we can replace this executive order. But the drawback of this constitutional guarantee is it would take time because it needs parliamentary legislation. Moreover, there should be timely elections. That should be happened, as also as I said that in the High Court case, there should be no delays in the election. And the third, last time when we convened our session, then the Professor Chetan Vedya suggested me that I should compare this model with other models as well. So I did so. So I compare this model with Kerala style fiscal devolution. In Kerala, they support the decentralization, and there is 25% state plan resources are given to local level. 25% of its state plan resources are given to local level, so that there could be less concentration of power at the state level, and there could be more decentralization at Kerala. We could also adapt that kind of strategy in J&K, but it would take time. And lastly, we should redraw the constituencies by population, but it is technically simple, but politically it's very difficult. So the proposed directions are there. We can take these we can take these policy options in two ways. First, short-term way, and second, long-term way. Short-term way, as we said that it should be backed by the 73rd Amendment, and we should restore a district planning committee under Article 243Z. And long-term way, because we can't change the system overnight. It would take time. So there are some things we can change gradually, like we can introduce Kerala style fiscal devolution to DDC. We can also implement equitable and delimitation of constituencies. And apart from that, we can also establish some kind of mechanism so that we could ensure accountability. These are some references, and I scoop out all these information from these references. Thank you so much.
Thank you, Fizan.
Thank you, Faizan. A very highly relevant governance and decentralization policy. Uh, Actually, the strongest contribution comes from what you have mentioned, distinguishing administrative decentralization from democratic decentralization. But my question to you is, Faizan, like, who are the institutions actually accountable to? Like, for example, you have mentioned to the citizens, local bodies, or to administrative hierarchy. For example, in your policy, the framework can become like BDC, panchayats, municipalities, and DTC. So, who has actually the functions? Who controls the funds? That also you have to mention. Who controls the functionaries or who is accountable? So, that is what you have to, your policy framework should ideally be like. Around like maybe three decentralization Fs, that is functions, who has authority to do what, funds कहाँ से आते हैं, who controls that, जहाँ से आते हैं, and functionaries. That is something your brief definitely has deepened the democratic decentralization, but you need to address couple of things. Like you have been saying that, okay, policy recommendation, your preferred approaches, strengthen the 73rd and 74th Amendment framework to this. But you need to clarify like what exactly should be changed. Like maybe specify the legal, administrative, and financial reforms, include maybe clearly functions or adequately funds and greater accountability to local institutions. What do you want? Like when you are talking about preferred approach, should be like you said, 73rd and 74th Amendment, this thing. Then again, like for example, we are talking about institutional, relationship you have mentioned. So who is responsible for planning and who will actually take decisions? For example, DDC, Panchayat, municipal bodies, and DPC that way. So we have to map the institutional arrangements or structure in that way wherein they should not overlap also. वो overlapping भी नहीं होना चाहिए, gaps भी नहीं होना चाहिए, and reporting mechanism क्या होगा वहाँ? Like for example, so ideally, like what powers would make DDC and panchayats, genuinely what you said here. After election खत्म हुआ तो अभी तक election नहीं हुआ. What will make it this concept make really workable and really doable kind of an institution. So these are few of the things that your policy document should address.
Definitely, ma'am. I will incorporate all these things. But ma'am, I'm unable to get the answer why elections are not conducted. So I try to search a lot upon it, but मुझे वो solution नहीं मिल रहा है. I think I should conduct a survey. Yeah.
First of all, I would suggest you as a policy person, find out what has changed, what it was पहले क्या था, DDC ने क्या change किया, and why do you want that it has to happen there? Unless and until you have evidence enough to talk, yes, this policy or this decision of the government was good and it has really changed what you said, because even though the elections have happened, but how it has enabled people to see some kind of positive change, how it has been beneficial for the people or has done the larger good for your community or those people for whom the DDC councils were actually kept as a grassroots level, democracy mechanism. अगर वो तुम evidence gather कर सकते हो, then definitely you can question it. You can have opinion pieces around it. You can have discussions and round tables around it, like why this thing is not happening. But unless until, or you can have policy documents and start talking to people. But then unless until your evidence does not say what change it brought, जो पहले था उससे क्या इसने, what notches have moved further, how it has been different. So once you gather that kind of evidence, then definitely you can have roundtables around it. You can have a policy talk like IMPRI आपकी इस policy को आगे ले सकता है.
Definitely, ma'am. I will substantiate this with further evidences. Thank you so much, ma'am.
Welcome.
Thank you, ma'am. Next, we have Suhani Khan. Your
Good
screen is...
evening. Is my screen visible?
Yes, it is.
And am I audible?
Yes, you are.
Okay. So, good evening, everyone. First of all, I am presenting on bridging the gap between policy and practice in India's child protection services. And the central argument of my research is that India has strong child protection laws, but the institutions which are responsible for implementing them, they lack the staff, they lack the funds and coordination which is needed to make these laws work. And the result is a gap between what the law promises and what children actually experience. Moving on. 1 second, sorry. Yes. So India has three main instruments for child protection. First is the Juvenile Justice Act of 2015, and it provides the framework for care, protection, rehabilitation, and social reintegration of children who are in need of care and protection, and as well as children in conflict with the law. And second is the POXO Act of 2012. It addresses sexual offenses against children and establishes special codes for speedy trial. Third is the Mission Vatsalya, which is the government's umbrella scheme for strengthening child protection services and institutions across the country. So, on paper, this is really comprehensive. The framework, it establishes clear responsibilities for institutions, and at the state and district levels, child welfare committees, district child protection units, and child care institutions. And these bodies are supposed to identify children in need, make decisions about their care, coordinate services, and ensure rehabilitation. But the problem is that a law on paper is not the same as a child in care. Like implementation is where the framework it actually breaks down. So the CAG audit of Delhi, which was tabled in March 2026, found significant gaps. First was the staffing. In government-run childcare institutions, staffing shortages reached 76% in critical roles like probation officers, counselors, and educators. So that means 3 out of every 4 positions were empty. Second is the district child protection units had vacancies ranging from 16% to 63%. And these are the units which are responsible for coordinating child protection services at the district level. Third is the financial gaps. Between 2018 and 19 and 2020 to 21, 22 to 38% of allocated funds remained unspent, and the budget proposal were submitted months late. So funds were released well into or even after the financial year. So staff salaries were delayed, food provision was affected, counseling and education services that children needed simply were not being provided. And this was not because the money was unnecessary, it was actually because the system actually somehow failed to deliver it. And the audit also found that the district child protection units mandated to maintain district wise databases and did not create such records in any of the 4 units reviewed. So child welfare committees failed to consistently track children after issuing care orders. And now let me bring Kerala for comparison. So Kerala, because Kerala is often held up as a model state with better social indicators and governance. And if similar problems exist there, it suggests that this is a national issue, not a Delhi specific one. So the 2025 Kerala CAG audit, it examined the integrated child protection scheme and other child protection schemes, and it found weaknesses in funding flows, structural implementation, rehabilitation, and also monitoring. And similar patterns were in Delhi. So the Kerala audit actually had a broader scope. It was covering multiple schemes. So direct comparison of specific numbers was not possible, but the patterns are consistent across both the states, which suggests that governance and implementation challenges remain as a national problem. And nationwide, India Justice Report found that across 292 districts providing usable data, only 142 legal cum probation officers were reported, despite every district being required to have at least one. So, in practice, this means many districts have no probation officer at all, and those who exist are very overwhelmed. And the same report found that across 166 childcare institutions, only 810 of the 1,992 mandated inspections had taken place, and which is only 54% of children in care institutions receive formal schooling. And So, what do we do about this? The brief does not argue that India needs another child protection law. The Juvenile Justice Act, the POCSO, and the Mission Vatsalya already establish good institutional responsibilities. The challenge is making these responsibilities operational. So, three things need to happen. First is we should strengthen human resource stability, which is we need to fill vacancies, we reduce staff turnover, and ensure that frontline staff receive appropriate training, and this can be done through better implementation of the existing Mission Vatsalya staffing framework. And second is improve fiscal transparency and accountability. So we need a structured system tracking fund release and utilization from the ministry to the state to the district. And this would help identify delays earlier and allow corrective actions before service delivery is affected. And third is to establish clearer interagency coordination. We need standard operating procedures between DCPUs and the child welfare committees, police, and childcare institutions, and an integrated case tracking mechanism would reduce the risk of cases stalling between these institutions. So my research, it draws on three main sources, which is the CAG audit of Delhi from 2026, the CAG audit of Kerala from 2025, and the India Justice Report. And the broader argument is that the gap between policy and practice, it is not the fault of individual institutions or personals alone. It is produced by the interaction of human resource constraints, financial management, financial management failures, and fragmented administrative systems. So, by comparing Delhi and Kerala, my research aims to understand how these factors operate in practice and identify realistic reforms that improve child protection delivery using the institutions and legal framework that already exists. And for the children in this system, the gap between policy and practice is not abstract. It's actually where they live, and it's time that we closed it. So thank you.
Thanks so much, Sohani.
Yes,
Your
ma'am.
your policy is actually very strong, and your policy topic is very well defined.
Thank you.
Policy problem. But you have mentioned, like, you have given the example of Kerala, wherein you said implementation gaps exist there. So I would like to know more about what do you mean by implementation gaps? That's one. Because you have to show, like, for example, when we do, is it that we don't have identified SOP standard operating measures? Is it that the indicators are not well identified? Or is it we don't know, like, what are the key roles? The people don't know the key roles. We don't have the mechanism of the governance, so monitoring and evaluation is not there. So what is it that we are talking about, or is it that people don't have understanding of it? When
Oh,
you're talking about the comparing like DEPSHU and CWC, for example, first of all, we need to compare like what DEPSHU and CWCs are mandated to do, what happens on ground. Like, for example, you mentioned that what are their roles actually? That we need to identify in a policy. So policy
yes.
problem definitely, when you talk about implementation gaps, we have to give 2 or 3 specific failures at maybe the geographies you have chosen. Then when you are talking about focus on DAPSHU and CWCs and Mission Vatsalya. So
Yes.
what are these institutions actually happen to do, and what is it, how we are going to sort of find the gaps actually, what they are supposed to do and what is missing? Staffing, they are mentioned that, okay, 1/3 or around, like you said, 76% or above 70% are
Yes.
missing, and you said almost 3 and 4 are missing, which is you have identified that.
Yes.
But when you spoke about those, you have to identify like what are the minimum staffing norms. Like,
Okay.
ठीक है इतना कम है लेकिन minimum क्या है? Is it that timely recruitment, or is it the we don't have funds, or is it the regular capacity building is not happening? So how many identity vacancies should have been at those places, and what are the skills that are missing? It's not that we have the people there, but is there
Okay.
something that on skill front they are missing? Then about the in every policy document, we have to look it from this angle कि stakeholder matrix बराबर है कि नहीं? What are the referral protocols? How do they coordinate between? What is the coordination mechanism? Do different departments coordinate with each other? So those kind of things. accountability norms में like who's accountable for what? When you say that weak accountability is identified, what do you mean by performance measure? Like do they have those kind of performance indicators? और अगर indicators है तो उसका standard operative measures है कि नहीं है? So those
Yes.
kind of things. And if you can study, 3, 4 different states, like, and what it shows with different kind of, structures across, like, maybe
Okay.
that will make it a bit, and overall a very good document.
Thank you, ma'am.
Yes.
Thank you so much.
Thank you, ma'am. Thank you, Suhani ji. Next we have, thank you, Megha ji. Next we have Manvi ji.
Shivani, we have Megha ji's presentation, then we have mine.
Sorry, yeah. Megha ji, you can start.
So, good evening, everyone. Can you hear my voice?
Yes, you're audible.
Hello, everyone. Thank you so much for being here. So, uh, so I'll start. So my the topic of my presentation is a policy shift from the revenue centric growth to physical and social stability in Uttarakhand. So basically, my presentation will talk about the Uttarakhand tourism policy and how this has impacted the kind of events and what is the policy, how it is going to be like, and the policy recommendation that we are going to discuss. Can we move forward? Yeah. So, what is the problem exactly? It's mentioned here. The Uttarakhand tourism link infrastructure has boomed. Highways, hotel, pilgrimage facilities. This includes them also, and it has coincided with a sharp escalating in landslide, flash flood, and land subsidence. So here is the data of ISRO. So in 2018, the landslides were 216. By 2023, it has increased by 1,100, and by 2024, 2,946. And when we see the footfalls of the pilgrimage, it is like 34 lakh 0.77 to 56 lakh. So we can see the when the footfalls of the tourism has increased. So here I just want to make the correlation between the disaster events and the footfalls of the tourist. So here we can see the intersection of these two things. And another thing is that it has been there. There's one more thing, that the tourism policy in 2023 offers it highest capital subsidy that we are going to discuss later. Discuss that those ecosystem, the eco-sensitive zones, the government, the tourist policy says that it will give the subsidies by 50%. That also contradict, like, if the infrastructure will grow, then how it is going to help the environment. So we'll discuss. Can we move to the next slide? Now, the thing that I have taken is the Uttarakhand tourism policy, and we'll talk about what the policy says and what are the gaps when it comes to the implementations and mechanisms. So I have taken two documents, like Uttarakhand tourism policy of 2023 and the operational policy. So first, what it says explicitly, sustainability language throughout the document is there. Environmental impact assessment provision reference was there. Low impact tourism framing positions as a guiding principle. But at the same time, when, as I have mentioned before, that category C district that are very eco-sensitive, Chamoli, Uttarkashi, and Rudraprayag, they are very fragile, and they get the highest subsidy up to 50%. That is the question we need to consider when we go through the policy, and this is come from the operational document. The second is that the approval committees, like whatever the infrastructure is being built, the approval committee does, they have finance admin official, but no environmental and geological regulator is formally represented in the committee. Third is the subsidiary document required construction plan, landslide paper, financial certificate. But EAI is not mandatory condition in that operational document. So that this is something that I have found the gap between what it says and what operations is doing, the operational document. Can we move to the next slide? So how my the methodology of my policy is policy paper would be. So it is so we have very short time to do this. Primary research, I am not able to do that because I don't like that time, I don't have. But it's like I have used majorly the secondary data, and I have taken it as a triangulated methodology. First, the primary official document that I have discussed as the policy documents, operational document. It also includes PIB, press references, National Landslide Risk Mitigation Project budget. Second is scientific and technical data that is come from ISRO landslide data, peer-reviewed studies on Char Dham highways, landslide correlation, Joshimath subsidence. Third is GIS hazard susceptibility findings. Third is journalistic and field level evidence that is also coming from the secondary literature. Stakeholder resistance reporting. The third is ground reporting on economic losses and the case studies, which also includes homestay models, one panchayat, and the Joshimath case study. Yeah, can we move to the next slide? Okay. So now here we can see the numbers, the quantitative impact, losses versus mitigation investment. So here we can see that as the policy says that it is balancing both ecology as well as the economy. But like when it comes to the sustainability, we can also see that not only the economy is booming, but at the same time, due to the ecological fragility of this particular state, they are also losing the financial aspect. Like here we can see like how many crores of rupees has been lost. Yeah, can we move to the next slide? Yes. So here the policy pathways I have, so I just wanted to make it like the feasibility, like how that won't be compromised, because the political thing is very important that the people would accept, because we cannot change the policy drastically, but it can be changed in a very limited way. So so I have the policy, one of the policy recommendation was on regulatory integration. So as previously we have found that the committees does not have the person who is geologically who knows the environment thing and geological expert. So the committee needs to include those people, and they need to know like what could be the impact of the infrastructure that has been built on the eco-sensitive zones. Second, on the incentive recalibration, so it does not talk about that we should not give the incentives to the type C categories of type C categories district, because these are the eco-sensitive zones. So I was also thinking that we can remove it, but I don't think we can, because the politically and the socially it is not possible. But at the same time, we can the thing that recommendation which is coming to my mind was that we cannot change it, but we can add some documentation, like the infrastructure they are making, the environmental impact assessment should be there, especially on those districts which are eco-sensitive, which comes under category C. And the third is community and institutional co-participation. So what is happening, that the infrastructures is being built without the consideration of the local people. So the one thing is that before making the infrastructures, it is very important. So that is one of my recommendation, to in those institutions that has been working in that in the eco-sensitive zone needs to be considered before making any infrastructure. Their their concern needs to be taken care of. Yes, this also include one panchayat, as we can see that one panchayat currently in informed roles into the consultative one. Yeah, and can we move to the next slide? So implementation strategy, though ma'am has suggested me to do this. So I have tried to, but ma'am, I would like your feedback on this. So implementation strategy is first is on regulatory integration. So key action would be on GIS portal hazardous integration. The timeline is between 1 to 12 months. And second is incentive recalibration, slope safety NOC, self-certification audits. Year is the timeline is between 1 to 4 years. And community co-participation, it is going to be from 1 to 5 year. And the worst thing that I wanted, uh yeah, this is the last slide. So it's like I also wanted to know the political risk assessment of those like implementation strategies and the recommendations. So this is all I have, and this is the last slide that I have, the implementation strategy. Yeah, thank you. Yeah, thank you.
Thank you so much, Megha. Uh, Actually, this is a very strong problem statement, and but I think that as a policy person that you are going to be, you need to distinguish between the correlation and causation. Like, for example, you have mentioned about tourism growth. But tourism growth cannot necessarily be cause of the landslides. There can be n number of things. There can be infrastructural or fragile geography or climatic, related hazards or weak carrying capacity. So when we straight away link of tourism to this thing in there, as a subject of their our policy, so then we have to be a bit carefully. Like, I think that you have to very clearly check the numbers, landslide figures, and then, for example, whether the landslides, like whatever you have reported, landslides, are they recorded by which agency and their authenticity also. And you have to be a bit like when you are talking about slide where we visually tourism growth, and which I already said, correlation does not establish like that. Tourism cause landslides, it can be maybe contributing to different other parameters also that you have to. Second is, you have mentioned about 34 lakh to 56 lakh, substantial increase. So can you identify like what is this percentage wise increase between these 2 years when you mentioned? And you have to strengthen the policy, contradiction also. Like, for example, show exactly which mechanism creates the problem, who receives what, and environmental safeguards kya hai. Those kind of things you have to identify in the problem. For example, so couple of things when it comes to regulate. Let's take as a in your concept note is very good, but policy brief में अगर हम 4 pillars रखेंगे, regulatory. So then you need to mention what should government do. Is it geological assessment, which you have mentioned in the end, like AIA, land use regulation. When we talk about the limit, अगर आप कह रहे हो tourism को sustainable करना है, कितना करना है? Is there some parameter to do it? And what are you going to limit? Are you going to limit the tourists? Are you going to limit the vehicles that are coming there? How many vehicles should be there? और what is the infrastructural limits, कितने बना सकते हैं, कितने hotels होने चाहिए? Is there some kind of data that is telling us about that? And when you are talking about the participatory mechanism, so again participatory mechanism इसमें आ जाएगा, when you are talking about the one panchayats, like, तो वन पंचायत में उनका रोल क्या होगा? Will it be decentralizing, or what will be their role vis-a-vis, like, looking into the participatory planning, or when those kind of, like, we are involving them, आप किस level पे उनको involve करते हैं, and is it doable looking at the structures we have? So your policy should address all that. And ultimately, how are you going to build the resilience? How are you going to prepare, like, climate adaptation, resilient infrastructure, disaster preparedness? अगर आप ये कर रहे हो, so in what way you are preparing the risks, like that there needs to be a risk mitigation plan also. So what all are those parameters that I think that you need to address that to make it more, strong policy document.
Sure, ma'am. Thank you so much. Thank you.
Thank you, ma'am. Thank you, Megha ji. Next, we have Manvi Sinha ji. You can start your presentation.
Am I audible and visible?
Yes, you're audible and your screen is visible.
Okay. Good evening, everyone. I'm Manvi Sinha, and today I'll be presenting my proposed research on legal literacy, a learning lesson in school, strengthening legal awareness among children through school-based education. The basic idea behind this research is that while we teach children about subjects like mathematics, science, social science, etc., we often don't teach them something very important, that is law that governs and protects their everyday lives. The motivation for this research actually comes from my previous research on juvenile recidivism, where I interacted with children in conflict with laws. During those interactions, I observed something that really made me think. Many children were not fully aware their action could have serious legal consequences. This was particularly visible in cases involving POCSO Act. For example, some children did not understand the legal implications of them running away with their girlfriends or boyfriends, or of engaging in certain relationships at an age where the law treats the situations differently. Similarly, in cases involving flights or certain online activities, some children did not necessarily perceive their behaviors as something that could bring them into conflict with law. And this raised a very important question for me. That is, can we expect children to make legally informed decisions when we have never actually taught them the law? This became the starting point for my interest in legal literacy. My field observation also indicated limited awareness of legal rights, responsibilities, consent, POCSO reporting mechanisms, and the consequences of certain behaviors, because the children did not have the knowledge about the consent, like what is consent and what is the legal age of consent. When I looked at the existing research, I found that this is not only an observation from my fieldwork. Existing researches also indicated that awareness of POCSO and child sexual abuse among children and adolescents remain inadequate. For example, one study involving 125 middle school children in Eastern India found that only 43.2% had adequate awareness, while 56.8% children had inadequate awareness about the legal knowledge. Recent literature also recommends school-based education, parental involvement, and open discussion to improve children's understanding. Because because the children learn first from their parents. If their parents motivate them or have some legal awareness, then the children can be mitigated from becoming in conflict with laws. Therefore, I identified a broader research gap. Instead of limiting legal awareness to occasional POCSO programs, we need to think about continuous age-appropriate legal literacy covering rights, responsibilities, consent, POCSO, cyber safety, and health seeking. Moving forward, I propose to study this issue through a mixed method approach. The quantitative method component will be a structured questionnaire to assess the baseline level of legal awareness among children and compare awareness across different age groups and social settings. The qualitative component will involve interviews of focus group, discussions with students, teachers, legal professionals, and child protection stakeholders to understand the barriers to legal literacy. Finally, I will undertake a policy analysis of understanding school and child protection frameworks, identify implementations gaps, and look forward developing an actionable school-based legal literacy model. Based on my preliminary field observations, I identified several areas of concern through which I am recommending certain policies. Children have limited legal awareness. One-time awareness program may not be sufficient for them because POXO are very poorly understood, and digital behaviors has created new areas of risk. Like the children are on Instagrams and all the social media platforms, and they post everything on them. That is also a big concern. Based on these observations, propose that legal literacy should be introduced as a structured and continuous component of school education. Rather than being treated only as an occasional awareness program, it should be age appropriate and include topics such as consent, child rights, POXO, cyber safety, reporting mechanisms like where they can report, to whom they can talk to when they are in trouble or they need some legal help, and basic legal responsibilities. At the same time, teachers should receive appropriate training and resource materials so that they can become effective for the students, for like they can guide them where to seek help and where to file cases or complaints. To conclude, legal literacy is not merely about knowing the law. It is about empowering children to protect themselves, make informed choices, and understand the consequences of their actions. I would also like to clarify that what I have presented today is not the complete research. This is just a pillar of my broader research. I will further develop and quantitative and qualitative investigations on this topic. My larger objective is to understand whether early and age appropriate legal education can contribute to child protection, informed decision making, and crime prevention. Because ultimately, we cannot expect children to navigate a society governed by law if we teach them the law, if we never teach them the law. Thank you.
Thank you so much, Manvi. I think Manvi, you know.
Yes, ma'am, it's Manvi.
Yeah. So Manvi, it was a good presentation, and your policy is more of an educational and preventive policy. So what I see is when you are talking about you call for legal literacy in schools. So I would like to know, like, what do you want basically in your whenever you're recommending to policymakers? Like, is it about the age appropriate models on these kind of policies or responsibilities or consent or online behavior? What is it that you want from those kind of, what exactly should children learn when we talk about age appropriate modules? Like, one is that. And when I think a bit of carefulness when we are talking about the POSCO, like field observations definitely suggest some children involved in POSCO-related situations lack the legal awareness. But that does not necessarily mean that those children who did not sort of like, if somebody knows that POSCO guidelines, like, or the POSCO cases are simply delinquents of legal education alone, and will only legal education can prevent the cases. It is a very, carefully, and we have to take caution when we say it just by understanding or just by knowledge of POSCO, something won't happen. So ideally, I would suggest like we have to treat children protection, awareness, prevention, uh, s- and access to help separately from juvenile offending. You understood that by what I mean?
Yes, ma'am.
Like,
Yes.
one thing is knowing the law. Second
Hmm.
thing is somebody getting involved into these kind of things. So necessarily, it may be or may not. There's a logic in it. It may be probably if they knew the law and if they knew the consequences, it may not have happened. But there is no guarantee about that.
Hmm.
And when you're talking about the implementation, so I think who will teach, how often, that also needs to be how often we need to have this curriculum or this education going on, or do you want it to be part of the school curriculum? and
Yeah, I want.
you want it to be part of the school curriculum.
Yeah.
So then you have to also give it a complete, action plan kind of a thing. Clear institutional model wherein we talk about, okay, it is to be, you want it to be at school level. So do the teachers want to be trained on that? What is the age appropriate curriculum that you are going to sort of support for the system? And what is the specialist support that they come, or is there some kind of funding mechanism? Because whenever we are going to make any change, you have to look it from the funding aspects also. Who is going to do what, and where getting the funding mechanism, budget kahan se aayega? और measurable output आप क्या रखते हो? Like, is it that people will have, and how are you going to do? Are you going to do a baseline and then see what is the awareness? How are you going to measure legal knowledge awareness or rights knowledge awareness or civic outcomes, rather than assuming a few offenses automatically result from the program? I mean, वो भी देखना पड़ेगा क्या हो रहा है नहीं हो रहा. So definitely, the policy is very good. Legal literacy, if you will ask me, can definitely, certainly be a preventive and protective intervention. But when we talk about the juvenile delinquency, has many cases. It is not just dependent on knowledge part only. There can be the family circumstances, there can be the peer influence, drug influence, social issues, poverty, substance abuse. Matlab, there are exposure to violence and other things. There are a lot of other things also that lead to this thing, but not, yeah, it can be a good preventive and, policy intervention. And I agree that, I mean, even though like age appropriate legal literacy in schools is good, and your policy can have like, simple framework like knowledge of the rights, responsibilities, boundaries, and those kind of things, and how people can take better informed decisions, knowing their what is the law, what are the rights, and those kind of potential reduction in unlawful
Number
behavior.
of cases.
Yeah, good, good preventive idea for a policy.
Thank you, ma'am.
Thank you, ma'am. Thank you, Manvi ji. Next, we have Soham Datta ji.
Hi, hello everyone. Am I audible?
Yes, you're audible and your screen is also visible. You must begin.
Okay, thank you so much. So,
You're not audible, Soham ji.
am I audible now?
Yes.
Okay, so very good evening, everyone, and the respected panel members. So, I'm going to talk about the title, Strengthening Regulatory Governance in India, the role of risk-based inspection system. So, in this presentation, we will see at how risk-based inspections can make regulatory oversight more focused and more accountable.
Soham ji, could you
Okay, so
please be a bit
firstly,
loud?
like why, sorry,
Could you please be a bit loud?
okay, sure. So firstly, like why do we need risk-based inspections? So regulatory authorities have to oversee a large and diverse amount of regulated entities, but their inspectors' time, technical capacity, and other resources are very much limited. And also at the same time, all regulated entities do not have the same level of risk associated with them. And this is the basic reason for using risk-based inspections or RBIs, as we can say. So let me explain the basic mechanism of RBI. So the process starts with risk assessment, where we identify the relative risk and relevant compliance information. Following comes the risk classification, where defined criteria are used to categorize the risk accordingly. Following that, inspection with direct limited resources as I've talked about before, uh, to be inclined towards higher risk entities. And finally, regulatory actions uses compliance history for further monitoring. And apart from that, we can also see that India has already gone into this kind of approaches. Firstly, FSSAI has started to use risk classification to decide inspection priority and frequency, giving greater attention to higher risk food businesses. Following, DPIIT has also started to promote central inspection systems, use based selection to improve coordination and reduce replication. And furthermore, Odisha's central inspection framework also combines risk-based and synchronized inspections with computerized scheduling, transparent processes, and inclusion of third-party inspection mechanisms. So together, these examples really does show that RBI is being used not only to decide who should be inspected, but also to improve how inspections and coordinations are governed. So, like this leads to the motivation behind this research that if India is already adopting risk-based inspection, how can these systems be governed to make them proportionate, transparent, and accountable? So, in this slide, we connect with the literature part and how evident it is in India. So, firstly, we have regulatory governance. So, the Organization for Economic Cooperation and Development, or the OECD, in its report has reviewed of India's regulatory policy and highlights the need to strengthen regulatory governance and improve the quality and coherence of regulatory processes. The second idea would be is risk-based regulations. So instead of treating all entities in the same way, regulatory attention should be proportionate to the level and possible impact of the risk. So then we can see three approaches in practice. Firstly, FSSAI has recorded around 56,260 risk-based inspections between the tenure of 2022 to 2025. Followingly, the CDSCO, or the Central Drugs Standard Control Organization, has also reported that more than 960 drug production companies has been inspected and more than 860 regulatory actions have been taken post December 2022. And followingly, the DGMS, or the Directorate General of Mine Safety, has also used a risk-based inspection system since 2016. So what does this add actually? So it really shows that RBI is already an operational practice across major sectors around India, but the main pinpoint would be the scale of implementation alone does not really prove that RBI has improved regulatory outcome. So this leads to the research problem. So as we know, the India is increasingly high risk-based and coordinated inspection mechanisms, but implementation varies across different sectors and jurisdictions. So this raises a very big question, like how risk is assessed, how inspection resources are to be allocated, and how coordination and third-party participations are to be included. So the central research question would be like, how are risk-based systems governed across selected Indian regulatory contexts, and what factors does influence their implementation? So the main four ideas would be like risk assessment, like how regulators define, assess and clarify risk. Secondly, would be the inspection allocation. Thirdly, the third-party role, as we have discussed. And the fourth would be the governance and accountability, like how transparent they are, how good is their coordination between the different departments, and how much they're accountable for it. So the scope at the end would be like is to have a comparative examination of selected Indian regulatory contexts, focusing on risk assessment, inspection allocation, third-party participation, and governance. So based on the evidence that I've shown so far, these are the main findings. Firstly, we have seen that RBI is operational, not just aspirational. It has already been implemented. Secondly, risk is very much sector specific. So like this cannot be defined using one single formula that includes each and every sector, each and every department. And thirdly, technology and data are becoming increasingly important for further study and further enhancing the policies and all. Fourthly, would be third-party inspections creates a question of governance because of the important issues like accountability, conflict of interest, independence of inspections do come into place. So based on these findings, there are four proposals for policy directions. Firstly, the transparent risk criteria that are clear, evidence-based, and regularly reviewed. Secondly, integrated regulatory data, linking inspections, compliance, and other surveillance and third-party information. Thirdly, proportionate inspection, where inspection frequency and intensity does match the level of demonstrated risk. And fourth one be like having a stronger third-party governance and also accountability for it while keeping clear regulatory responsibility. So, like to conclude, I would like to say that India doesn't need to inspect everything equally, but it needs to identify what matters most, act where the risk is great, and remain accountable for every regulatory decision. So, thank you, ma'am. Looking forward to your solution.
Thank you so much, Soham. So if you will ask me some couple of questions, like we already have the risk-based inspection happening in India. Your policy definitely is addressing the regulatory governance issues. Your document has the elements of regulatory policy, compliance forms, ease of doing business, and everything else. But my question is, I mean, if you can strengthen, you have used the framework of like you have shared FCI, DPIIT, and Odisha. So how you can compare it? Like, how is the risk assessed? Maybe FCI, DPIT, and Odisha. That will strengthen your comparison. Like, what are the common principles of it? Then if you can actually like between these three, like DPI, first of all, why you have chosen FCI, DPIT, IIT, and Odisha? Who classifies the risk? Like what are who institutional responsibility, and within institutional responsibility, what are the elements of that? And how frequently inspection is happening actually? That also, if you can sort of within the framework mention that. And data sharing, like what is the mechanism, is it interregulatory or whatever it is, like those kind of things. So one important actually conceptual framework is RBI is not only actually reducing the number of inspections, but I think you have to also talk about like using the scarce resources where risk is the greatest. So for that you have to sort of look at it, what does the evidence say? It is actually your topic is you can say like very promising regulatory governance concept, because India, even though like it already has risk-based bodies, but the key policy contribution should therefore be how to identify the governance gaps in this classification, coordination, transparency, and actually then if you can distinguish between these three, like what you have mentioned, Odisha, FCI, and DPI, IIT, like, and propose some common principles for smarter, regulations, like in the end, that would be really great.
Thank you so much, ma'am. Thank you for your feedback. And
I
surely I
also
will
wanted,
incorporate.
I also so wanted to understand actually, when you are identifying the policy problem, like, is it that you are talking about the duplication or excessive inspections, or that is not very well coming out from your abstract you had shared? Like, is it the risk classification inconsistency, or the accountability and governance mechanisms are not there? So if you can, a bit of like problem statement, if you can work on that as well, like sharpen the, problem space.
Sure, ma'am. Sure.
Thanks.
Thank you so much.
Thanks so much.
Thank you so much.
Thank you, Soham ji. Thank you, ma'am. Next, we have Kanchan ji. Kanchan ji, you're not audible.
Can I start?
Yes, yes, you can begin.
Okay, I am visible. Hello.
Yes, your
Your PPT is visible.
PPT visible and start video. Okay, I'm starting. Thank you, ma'am, for providing me this opportunity. I'm Kanchan Mondal. The topic of presentation is in Digital India Land Records Modernization Program, the challenges and policy implication for land governance in India. The special focus and reference and will be my state, West Bengal, as I'm being part of this land administration. The policy problem is the India's land administration remain affected by outdated records, fragmented institutions, inaccurate cadastral maps. Digitalization has improved the access, but digitized records are not necessarily accurate or up to date. Weak land records contributes to dispute, delays, transaction costs, and opportunity for the rent seeking. DILRMP seeks to modernize land record registrations, mapping, and revenue administration. Key argument: the success of DILRMP should be measured by the better land governance, not simply by the number of records digitized. Next slide, please. Slide number 2, the motivation and the policy relevance. Why does DILRMP matters? Actually, the why this topic has chosen, secure the reliable and the land records and strengthen the property right. Better records can reduce the land dispute and transaction delayed. Digital service can reduce the citizen dependence on intermediates. Accurate land information support investment, infrastructure and credit access. West Bengal provides a useful case for examining how a national program translates into state level service delivery. The topic and dilemma, the digitalization good land governance. The critical question is whether investment in DILRMP produce the measurable improvement in record accuracy, mutation, speed, citizen access, dispute resolution, administrative efficiency, and transparency. The presumptive and rather than the land administration is guaranteed in reality. While the land information has historically been dispersed and across the department. Next slide, please. Slide number 3, literature review and the review and evidence. What does the existing evidence tells us? Literature, according to World Bank studies published in 2007, effective land administration is important for growth, poverty reductions, secure property rights. And the Government of India, DILRMP, combined the computerization, cadastral map, digitization, registration, integration, modernization record rooms, GIS-based initiatives. Evidence of progress, record of rights of computerization 100%, sub-registration offices computerization 100%, revenue code computerization 93%, cadastral map digitization 97%, survey and resurvey completed only 15%. Here is certain kind of lacking behind the digitalization. The key insight, the largest remaining gap is not the basic computerization, it is an updating and verifying the land information against the ground reality. Next slide, please. Research questions and methodology. The first research questions would be how effectively the DILRMP improve the land record accuracy, accessibility, and administrative efficiency. Questions number 2, what implementation challenges limit its impact, particularly in West Bengal? And the third question is, DIRLMP is cost effective. The methodology is the mixed and the policy evolution, and quantitatively we have taken mutation turnout record, digitalization and cadastral map, and registration land record integration, grievances service delivery data, and qualitative West Bengal case study, the policy institution documents and semi-structured interviewed with official, citizen, stakeholder and others. Next slide please. Finding, challenges and policy implementation. The digitalization, the finding challenges is strong progress, the basic of computerization, spatial record and verification resurvey remains a major gap. Institution, the multiple department create and coordination challenges. Citizen survey, digital access and exist, but digital literacy access can affect inclusion. Governance, digitization alone does not eliminate the discretion error of dispute. West Bengal case, the Banglar Bhumi platform has been operating ROR, grievances service, revenue court information. This demonstrates the movement towards citizen-facing digital land governance. However, the evolution must examine whether the online availability translates into faster, cheaper, and more reliable outcome. Cost effectiveness of the concern, DIL RMP received 125 crore in 2026 and 27 budget, which is 46% below the last average. Therefore, the future spending should increasingly be linked to measurable governance outcomes rather than digitization target alone. The last and the next slide, please. Recommendation and conclusion. The policy recommendation, first one, shift from digitization to the data and quality, prioritize the survey, resurvey and verification, regularly update the cadastral map and after the transfer, inheritance and subdivision, the build the true interpolaritability, integrate the revenue administration, cadastral taxations and the code database, use the common identifier, license and Bhu Aadhaar where and appropriate, the make the performance outcome based, error mutation should be free, disputes should be reduced, grievances should be reduced, citizen satisfaction and cost per transaction. Number 4, the strengthening of citizen inclusion, maintain assistance by digital service, the lacking the digital access is problem, provide transparent status and tracking and grievance and escalation, introduce the systematic code effectiveness and evolution, compare the program expenditure with administrative saving and citizen benefit, prioritize the intervention with the highest measurable governance return. In conclusion, I would suggest DILRMP has moved India significantly toward the digital land administration, but the next phase must move from digitized record to trusted record. The final message would be like that: digitalization is a means, not the policy outcome. The ultimate goal is accurate, accessible, transparent, and accountable land governance, which India far from distant dreams. Thank you, ma'am, for providing this opportunity to present my paper.
Thank you so much. Thanks, Kanchanji. I think you spoke last time. There's a lot of noise.
Hello.
Hello.
Yeah, ma'am.
Kanchanji, thank you so much for this wonderful presentation. I think that you have already addressed most of the things, and you have actually spoken about a couple of things that how it can be strengthened. For example, when we spoke about revenue officials may not have the digitized or GIS skills. So I think that the policy document should fill the critical, gaps, and that needs to address like how we are going to train these kind of revenue officials, how we are going to have GIS and data, and how they can have the accurate data, and then what is the funding mechanism, where from we are going to have the funds. That is very important. Whenever you are suggesting something, we have to put those financial budgets into picture. Second is about the coordination. I mean, we need to have clear kind of coordination mechanism defined between responsibilities between like land records, registration, survey mapping, and administration that may work separately, and how we are going to have coordination between land and these departments. So that is something that if you can sort of address that. And second is about grievance and correction. So how we are going to have timely process? Is there some kind of SOP or some kind of why citizens are actually struggling to correct errors in digital records? So what is the mechanism? What are the systems and policies? How we can make those systems? It is not just about the digitization. It is more about like, one is having the digital governance policy issue. Second is how we, which you also mentioned, how we can make it stronger from digitalized land records to demonstrating how institutional reforms and digital system can produce accurate, accessible, and citizen-centered land records. So for that, we have to look into like how we are going to monitor and be accountable, monitor accuracy, have systems in place, check like what is the accuracy parameter there, how citizens complaints and service delivery, have a helpline for that. So these kind of systems as a policy thing, we may have to put into the policy. Thank you, Kanchanji.
Thank you,
I'd like
ma'am.
to
Thank
do-
you, Kanchanji.
Thank you. Thank you.
Next, we have Sakshi ji. Your screen is visible. You may begin.
Okay, thank you so much. Good evening, everyone. Since it was a creative presentation, I took the liberty of calling it a grain for thought. Since it was a creative presentation, I took the liberty of calling it a grain for thought. PM Poshan and the monitoring challenge. And as the slide suggests, why oversight, that is the monitoring, and not funding. That is what I'm be focusing on. We all know that PM Poshan has been existing for a long time now. But the real question here is that is it actually reaching the people it is meant for? Is it working the way is it supposed to be? So it serves around 11.8 crore children, ranging from classes 1st to 8th, and currently it is in its phase of year 2021 to 2026. Midday meal is part of the Poshan Shakti Nirman, which is aiming to fight classroom malnutrition, lower enrollment, and is considered one of the largest school feeding efforts anywhere in the world. But I would like to reiterate the question, does this scale guarantee the quality of the policy that is going on? This scale creates a trap. It is easy to measure a program by how many people it reaches and much harder to ask whether it is reaching them. So that is the real question. Does this scale guarantee the quality or not? When we speak about monitoring, officially, these are the aspects that come under the monitoring for the PM Poshan scheme. First is the DEX monitoring, which includes the quarterly progress reports, the expert committee reviews, mostly paperwork. Then we have the field monitoring, which includes the reports of the joint review missions, social audits that have been conducted. The third aspect here would be the institutional oversight, the quality control committees, the school management committees, and third-party audits, which are responsible for local checks. Then we have the technology tracking, the MIS portal data, where the data is actually put forth by the officials as required. So what my studies have so far indicated that funding is not actually a major problem, but somewhere it does need to be studied, as ma'am had already mentioned in her comments, that we should see about the funding aspect as well. I am also seeing that monitoring is a major gap as far as the PM Poshan scheme is concerned. If we look at Andhra Pradesh SCAG audit report, it looks at the quality control committees which are not operating in the districts that the audit was carried out in. Then we have the undetected quality lapses that Gujarat has seen instances where meals were served cold and it did not even have the exact apparatus required to measure the temperature. Then we have the recurring safety incidents. Bihar reported over 100 food poisoning cases in 1 month alone. And 3 days back, a latest news came up that in Bihar Sharif, in place of salt, detergent was used for cooking food, and that has affected the children who were eating those midday meal. So that is why we need to look at the monitoring part. And then we have the monitoring guidelines, which have really gone stale, which are not updated properly. The most recent data that is available on the PM Poshan portal is of the year 2014, and the latest review reports go back to 2022 or 2023. So these are the states that I will be taking over in my study: Gujarat, Andhra Pradesh, Bihar, Karnataka, and Delhi, in order to show a diversity in comparison, and also because the cases have been reported too frequently in these states. That is why they have been taken, and it avoids and it restricts my case study from going wider and coming to a particular angle. For my methodology, I'm combining secondary data analysis with a multi-state case study, as previously cited in my last slide. Secondary data analysis, where I will be looking at CAG state audit reports, the NFHS 4, 5, and 6 health survey data, the PM Poshan MIS portal and the PIB releases, and published research and policy commentary by various academic sites. For case study method, I have taken 5 states, and each case will be examined for its distinct failure or success, and it would allow me to have a cross-case comparison. If we look at other root causes as well, we would see that the guidelines are frozen. They are not updated since 2014, as I've already said. Then the data that is available on the MIS portal is actually not aligned with the ground reality that is happening. Then we also see a weak intersectoral convergence between Anganwadi. As I remember in my previous sessions, ma'am pointed out that I should look at this angle as well, and that is why I'm studying it further. And that coordination part between the Anganwadi via committees at the block level, and then the NFHS 6, which dropped the anemia indicator, which forms a major part of understanding the nutrition and well-being of the children. But I would not say that everything is broken, that everything is bad about the policy. No. Community participation program has increased teacher attendance in states like Chhattisgarh. Maharashtra is using zonal supervisors plus face detection technology and food identification imaging to flag malpractice. The reason why I included Brazil in this case study is to, as part of a recommendation that as policy makers, as policy analyzers, we can also look at similar policies that are taking place already in other countries and maybe analyze how the recommendations can be replicated in India. So overall, the recommendations would be for closing the monitoring gap, reactivating and regularly audit state-level quality control committees, update the desk's monitoring guidelines beyond the 2014 framework, increase the community participation, integrate the MIS portal, and just like Maharashtra included food identification technology for malpractice, we can maybe implement the same in other states as well, and looking at similar schemes adopted in other countries. So to conclude my presentation, it is a policy whose monitoring architecture has not kept pace with its own ambition. It is not a policy in decline, but just that the architecture needs certain updates. Thank you.
Thank you so much, Sakshi. This is a policy very close to me, and you have addressed it. But Sakshi, even though like you have a good plan and the policy is good, but then I would like to sort of look it from different perspective. Even though you gave the example of Karnataka, Gujarat, Bihar, Andhra, and Delhi, you are taking in this in your state-wise differences in monitoring. And through monitoring, definitely you will address the implementation challenges also, because your monitoring will lead to that. But my question is still, like you said, there are cases from Bihar, Karnataka, and there have been a number of cases. So what makes you to think that there have not been cases from other states of India, number one? And number second, what were the key objectives of Poshan when Poshan Abhiyan was reached? So don't you feel that ideally it should be, your policy should be around like reducing stunting, or reduce undernutrition, or reducing anemia, or low birth weight babies, or maternal and child nutrition? Based on that, you could have said that the key objectives of Poshan policy were these 5, 6 things. But in these states, it has not. Or is it that you want to identify only the midday meal scheme of the Poshan, which you want to address, and that is why you have taken only these states wherein there were some kind of disparities when it comes to the monitoring and execution. What your statement is. Number one is I wanted you to maybe probably in your policy document address that thing that within the policy document I am addressing this component of the portion because portion was very big. उसमें mothers भी आती थी, adults and girls भी आती थी, बच्चे भी आते थे, midday meal भी आता था. But then within that whole gamut, then you have to say that, okay, we want based on the midday meal scheme or the portion that was given to Anganwadi centers, number one. That. Number second is what is it that I would like to clarify about when you are saying that disparity, is it about the food quality? Is it about the, like you shared example of Bihar? Probably salt, detergent is more costlier than salt. So that may not be the question. They use detergents because it is cheaper than salt, but probably वो अंधी होगी उसको दिखा नहीं होगा या उसने देखा नहीं कि सर्फ और इसमें दोनों साथ साथ थे और उसे गलती होगी तो इट कैन बी ए स्किल इशू इट कैन बी ए क्वालिटी इशू not necessarily because of that. So how we are going to change those kind of things? Like, is it that when you are going to talk about the monitoring, is that we don't have the same kind of, SOPs well prepared, indicators with SOPs and coverage? And is there some kind of grievance redressal mechanism wherein that we need to have uniformity across? Like we need to clarify those kind of problem statements and maybe probably 2, 3 measurable. What are the key monitoring or implementation gaps? क्योंकि जब आप मॉनिटर करते हो आपको पता चलेगा इम्प्लीमेंटेशन हो रहा है कि नहीं क्योंकि जो इम्प्लीमेंटेशन ऑफ द पॉलिसी है वो मॉनिटरिंग के थ्रू ही आ जाएगा. And second, मैंने आपको बताया about the 5 states that you have chosen. So that also needs to be a bit sort of more. Then you have to talk about the interdepartmental role. Like who monitors PM portion? Like उसमें आंगनवाड़ी भी आ जाएगा, उसमें schools भी आ जाएंगे, उसमें out of school girls भी आएंगे. तो अगर first you have to identify is it just the portion में आप सिर्फ बच्चों को ले रहे हो 1 to 6 और आप adults and girls को भी ले रहे हो या आप माताओं को भी ले रहे हो. So that needs to be identified in your this. So monitoring up, then definitely there will be different kind of monitoring patterns. And are you going to map it against the school, district, state or center? किस लिए आप monitor कर रहे हो?
Ma'am, I am monitoring on the state basis. It is a central level scheme, but my intervention, my policy would be focusing on the state level. And as you've said about the quality control and community, including mothers and all, they will be separate topics in my paper. Like I will be speaking about community participation as part of my recommendation that they should be increased furthermore. And I will also be speaking about the quality. Now, as I cited the example of Bihar Sharif, that it could have been a skill issue. But ma'am, that is what is a part of my recommendation, that we need to increase these audits more. Naki, it's not like the same state could report 100 food poisoning incidents in 1 month. That is something that we need to look at.
Sakshi, how deep you have gone in this policy? It is a central policy, but central policy delivered at the grassroots level, at the Anganwadi center level, at the school level. So when you are saying that you are taking state as, your policy, मैं आप state से level से ले रहे हो. So then you have to look it from the perspective of, is it bottom-up approach or is it top-down approach? क्योंकि ideally for this policy it was a bottom-up approach. कि आंगनवाड़ी center में खाना मिलता है कि नहीं, schools में खाना मिलता है कि नहीं. And when we used to go like me as a health, when I was with Minister of Health, when I used to monitor, I used to go to आंगनवाड़ी sectors and check it there like कि क्या है, what is the kind and kahan pe gaps and those kind of things. So जब आप कह रहे हो कि you are doing it at state level, so that means you are completely dependent on secondary data only.
Yes,
It's
ma'am.
not something that you are getting the ground data from the Anganwadi center. You understood what I mean to
Yes,
say?
ma'am. Yes, ma'am.
So those things also you have to sort of look into. It is a good and focused policy issue, but when you talk about state disparities, identify like how you are going to measure it,
Okay, ma'am.
and a bit on connecting it to the main objectives of the portion, right?
Yes, ma'am.
And then talking about the आपका key parameter, is it just the food quality and food, or is it that the key objectives of portion that you want to address?
Okay, ma'am.
So those kind of things a bit, देखो, it's a good, very good, policy, identification of the policy problem is very good. Just go a bit deeper.
Okay, ma'am. Certainly. Thank you, ma'am.
Right.
Thank you, Sakshi ji. Thank you, ma'am. Uh, Thank you to all the fellows for your presentations and for sharing your ideas and perspectives. We would also like to sincerely thank ma'am for her valuable comments, feedbacks, and guidance throughout the presentations. We hope the fellows found the feedback useful and will carry these insights forward in their work. Ma'am, would you like to share any closing remarks?
I think that it was an experience. I should say that it has been a wonderful experience, and that the kind of range and the kind of policy ideas you produce here has been really very good, right from, AI to justice, the cognitive skills to potion, to climate resilience, to heat action plans, to ESG and whatnot. So it has been like, women's political representation. It has been quite a grill for me to understand a lot of concepts when I was going through your papers also. But definitely, I would encourage you to move beyond your, whatever you have thought of. You need to strengthen the coordination, create awareness, and those kind. Importantly, ideally, if you'll see, public policy is really about finding the perfect solution, but it is about making choices among us the priorities, like, because we all know that funds are limited, so we have to prioritize. So what are the best policies and how we are going to recommend it? Understanding trade-offs, that's also very important. As a policy person, you should understand. Identify the stakeholder matrix, again, very important when we talk about uh, who are the stakeholders. And when I always say, like, who does it? When do they do it? Four W's and one H, how? That is very important. Understanding SWOT analysis. I think that simply I would like to end it with that your objective as a policy person should not simply to produce a well-documented paper, but your objective should be like how to produce a policy argument that policymakers will understand. There is a huge gap. Like I have seen both sides of the research as well as into government. Why government people, they refrain from reading big things? Okay, they don't have that kind of time. So your policy document should be framed that way that they will try to understand it, they will act upon it, and they will try to do that. So something of that sort should be your purpose. Overall, very good experience. Thank you.
Thank you so much, ma'am. With this, I'll proceed with the formal vote of thanks. As we conclude day 7 of PPYF, Public Policy Youth Fellowship, Cohort 2.0, I, Shivani, on behalf of IMPRI, Impact and Policy Research Institute, New Delhi, extend my heartfelt gratitude. We sincerely thank our chair, Dr. Manorama Bakshi, ma'am, for giving us your valuable time and engaging us in such a meaningful and insightful discussion. We also extend our gratitude to all our participants who raised pertinent questions, presented their work, and actively contributed to today's deliberation and to such a vibrant learning environment. Session recordings and resources will be shared via email. A video recording of today's session will be available for reference. We look forward to seeing you on day 8 of this fellowship. If you're following our work by watching it on YouTube, listening via podcast, or reading our publications, we truly appreciate your engagement and support. Once again, thank you all for being a part of this initiative. Wishing you a great evening ahead.
Thank you. Thanks.
Thank you, ma'am. Thank you, everyone.
Thank you.